Let's be real. If you're watching this, you probably have one huge, burning question on your mind right now. Is it actually possible to get pregnant if you have PCOS? Well, I want to start right off the bat with a very loud, very reassuring yes. Now, getting there might take a little bit of help or medical guidance, but achieving pregnancy is absolutely possible for sure.
Welcome to The Explainer. Today, we're diving into a really supportive, highly focused look at Polycystic Ovary Syndrome, or PCOS, and exactly how it impacts your fertility. We're pulling all of our insights today directly from the fantastic patient resources put together by Fertility Clinics. Our goal here is simple. We want to break this down, cut through the confusion, and give you the clear, actionable info you need to feel totally empowered about your reproductive health.
Okay, let's dive into this. Here is our roadmap for today. First, understanding PCOS basics. Second, recognizing the symptoms. Third, diagnosing the condition. Fourth, managing your menstrual cycle. And fifth, treatments for infertility.
Starting with Section 1, understanding PCOS basics, because getting a handle on the facts is the very first step to taking back control.
You know, if you've recently been diagnosed, you really need to hear this. You are far from alone. Seriously, PCOS is actually the single most common endocrine, basically hormonal, disturbance affecting women today. It's what we call a highly variable condition, which just means it exists on a massive spectrum. For some, it's super mild, but for others, it can cause much more severe hormonal, reproductive, and metabolic shakeups.
So why exactly does it happen? Well, there's no single magic answer. It's kind of like a giant puzzle with a lot of different pieces. A massive driver, though, is high insulin levels. You see, many women with PCOS are resistant to the normal effects of insulin, so their bodies just pump out a ton more of it to compensate. And that extra insulin, it actually triggers your body to produce more androgens, which are male hormones, and that completely disrupts ovulation. Aside from insulin, genetics definitely play a role, meaning it often runs in families. Plus, there's a strong link to low-grade inflammation or even autoimmunity that might be stimulating those polycystic ovaries.
Moving right along to Section 2, recognizing the symptoms. Let's talk about what's actually causing those frustrating changes in your body.
You've probably heard a doctor throw around the word hyperandrogenism. I know, it sounds super intimidating, right? But let's translate that. It literally just means you have increased levels of male hormones, like testosterone. In your day-to-day life, this translates into those physical symptoms you might be dealing with in the mirror. Things like stubborn acne or excess unwanted hair popping up on your face or body.
And then there's another major term, ovulation. Basically, this is when your ovary just fails to release an egg every month, like it's supposed to. And think about it, if an egg doesn't drop, you don't get a normal period. That leads to cycles that are all over the place, or sometimes periods that just vanish completely. This right here is actually the primary reason women with PCOS struggle with infertility.
Now, what's really interesting about this breakdown is how clearly it separates what you experience on the outside from what's secretly going on under the hood. On one side, you've got the physical stuff, acne, facial hair, obesity, which, by the way, can definitely make the whole syndrome worse. But on the other side, we see the hidden internal engine driving it all, the skipped periods, elevated androgens, high LH, and spiked fasting insulin. Looking at it this way, it makes it so much easier to understand PCOS as a fully interconnected whole-body system.
Okay, I just want to slow down here for a second. We really need to talk about the long-term picture. If you just ignore it, the metabolic chaos of PCOS can actually lead to some severe stuff later in life. We're talking diabetes, cardiovascular disease, and even endometrial cancer. I know, that sounds absolutely terrifying. But here's the incredibly empowering part. Getting diagnosed early and actively managing it, especially through weight loss, acts as a literal shield against those long-term risks. You have so much power to protect your future health here.
All right, Section 3, diagnosing the condition. Let's look at how the doctors actually figure this out.
Honestly, getting a diagnosis is a very straightforward, unintimidating process. It's a simple 3-step sequence. First up, you chat through your medical history and have a physical exam so the doctor can understand your symptoms. Step 2 is a quick pelvic ultrasound. And Step 3 is just some blood tests to get a clear picture of your specific hormonal profile.
Just to give you a heads up on that second step, the pelvic ultrasound, what the doctor is doing is looking for something very specific. They are checking to see if your ovaries are enlarged and if they have multiple little cysts hanging out in there. When they combine that visual confirmation with your blood work and your daily symptoms, they get the exact picture they need to give you a solid diagnosis.
On to Section 4, managing your menstrual cycle. This is especially relevant if you're focused on your daily health right now and aren't quite ready to try for a baby.
If you're carrying extra weight, safely shedding some pounds is generally the absolute first recommendation because it can literally naturally reboot your ovulation. But if lifestyle changes aren't enough, there are some great medical options. Your doctor might put you on an oral contraceptive pill, or they might use progestogen tablets every month or two just to force a predictable, healthy bleed. They could even suggest the Mirena coil, which is awesome because it continuously releases progesterone right exactly where you need it, inside the uterus.
Now you might be wondering, why go through all this trouble to force a period if I'm not even trying to get pregnant? Well, the ultimate goal here is to keep your endometrial, or uterine lining, nice and thin. By getting your periods back on track and keeping that lining thin, you are drastically cutting down your risk of developing endometrial carcinoma later on. It's all about actively managing your long-term health.
And finally, Section 5. Treatments for infertility. This is the pathway of hope for couples ready to conceive.
And this brilliantly illustrates how we handle PCOS, depending entirely on what you want. Look at these two totally different pathways. On one hand, you have cycle management, using things like the pill or the Mirena coil to protect your long-term health. But on the other hand, if you want a baby, the toolkit changes entirely. Because the big hurdle is anovulation, the whole medical strategy shifts toward actively making that ovary release an egg.
So, if a healthy diet and weight loss don't kickstart ovulation on their own, we bring in the meds. Clomiphene is usually the first-line oral pill they'll try. Another popular oral option is letrozole. Now, if those pills don't quite do the trick, your doctor might step it up to gonadotropins, which are just tiny injections given right under the skin. Oh, and you might also hear about metformin. It's technically a diabetes drug, but it's a real game changer because it improves insulin sensitivity, helping your body fight back against that insulin resistance we talked about earlier.
And please, remember this. You are literally never out of options. If lifestyle tweaks and ovulation meds don't result in that positive pregnancy test, in vitro fertilization, or IVF, is an incredibly effective, advanced backup plan. Places like ART Fertility Clinics specialize in using IVF to just completely bypass the hurdles of PCOS, directly helping you achieve that pregnancy.
To really wrap this all up, Professor Dr. Human Fatimi, who is a consultant in reproductive health, puts it perfectly. He says, early diagnosis and management of PCOS is key. Your healthcare provider will formulate a management plan specific to your requirements. I just love that because it reminds us that this is absolutely not a one-size-fits-all thing. You don't have to figure it out alone. Your clinical team is there to be your partner.
So what does this all mean for you? We've talked through the biology, we've decoded the symptoms, and we've explored some seriously effective treatments. Whether you just want to get your health on track or you're ready to start building your family, the tools are right there. The experts are waiting. So the only question left is, are you ready to take charge? Reach out to a fertility expert and build your specific management plan today.